Welcome back, guys. This is Marissa Staten with Revitalize MD. Today is our next segment on Q's and A's, and today we'll be talking about SkinPen. But before we get there, don't forget to like and subscribe our channel. It only helps our algorithms and get more videos out there to you. Okay, guys, we're going to be watching a video of me doing a SkinPen treatment on one of my patients. And let's go to the first question. SkinPen is the only microneedling device that is approved by the FDA. It's going to create micro injuries into the dermis with microchannels, and your skin is going to repair from the inside out, which is going to help repair, stimulate collagen elastin first, and it's going to help with many different things with the skin. Microneedling is great for acnetic scars, fine lines and wrinkles, pore size. Usually it helps with melasma, but it's a great treatment for anybody to do. Another thing about the SkinPen cartridge that makes it unique is, well, first, the cartridges are one-use cartridge for all the SkinPen. Once we use that needle cartridge, which has 12 needles on in each cartridge, that is disposed of. Second is that if you were looking at the 14 needles under a microscope, it would look like silver bullets. They're very smooth. They're not going to create microscopic tears. They're just going to create micro channels into the skin. The benefits, there's many benefits of SkinPen. Well, first, you're going to have brighter skin. You're going to have more even skin. It's going to help shrink pores. It's going to help with static lines. It's going to build collagen elastin. There's so many benefits from this. It's kind of like, why wouldn't you want to do a SkinPen microneedling treatment? That is a very good question. First is, does the SkinPen microneedling treatment hurt? First, we're going to take that into consideration. We use really good numbing cream. Apply it to the skin about 30 minutes prior to the treatment. So I won't say it's painless, but it's going to be almost painless. There's going to be some places on everyone's skin that they may feel a little bit more, such as around the chin, maybe the nose, forehead, just usually certain areas. And you can kind of see the little details that I do that help prevent them from feeling very much. But is it painful? No. Is it painless? Also no, but virtually almost. Patients who have active skin cancer, who are pregnant or breastfeeding, patients who are taking medications such as blood thinners and Accutane are not good candidates for SkinPen. Also, anyone that is suffering from a blood disorder, that would be patients that I would say are not good candidates for that. I'm always going to recommend 3 treatments of microneedling because we want to stimulate collagen elastin. You're only going to get better benefits after doing 3 treatments. Do you have to stop there? Absolutely not. If you have major acne scars, deep pitted scars, I'm going to recommend 6 treatments. But let's go ahead and start with 3 because it's very hard for people to make a commitment for 6, I find. So 3 treatments for sure, and let's reevaluate after your 3rd treatment. There may be something else I recommend, but for the most part, SkinPen microneedling is going to be my favorite procedure for pitted scars in general. So we would have a consultation and create a plan for each specific patient to make sure that if they need 3 or more or combination treatments. Absolutely. I highly recommend doing PRP with your SkinPen treatments always. First, those who don't know what PRP is, that is platelet-rich plasma. That is where we take a vial of your blood, spin it in a centrifuge, and dump your own natural growth factors into your skin while we're creating the micro injuries to help your skin repair even more. The benefits are even better. There's less downtime. I highly recommend this treatment, especially if you have also melasma, because of the downtime is so much less. You have less inflammation, and I highly recommend those 2 together. The combination of PRP and SkinPen is called Vampire Facial. I'm sure you've heard of that. It's a very popular name out there, but PRP with SkinPen microneedling is a perfect combination. I would highly recommend it that way. As far as downtime with SkinPen and microneedling, the first 24 to 48 hours is going to be when you probably have more social downtime. Social downtime is probably you don't want to go to a party or be out in public because your face is probably going to be red right afterwards. And let's go ahead and assume some people are red the next day. Not everyone. If it's your first treatment, let's go ahead and assume that, well, you're going to be red, and let's not plan anything for 48 hours. That being said, most people are fine the next day. As far as products that you put on the skin, there's some pre and post procedures to go along with that, and I'll answer that question in a moment. Precautions pre and post is, I don't want you to be sunburned. I want you to be off your retinol for, according to which one you're using, at least 5 days. I don't want you to be sensitive, sunburned, peeling. That's some precautions to take into consideration. Also, as far as after the post procedure, I'm very specific on products that you're going to use or not use. The first 3 days I think are the most important, but I'm always going to give you a 5-day protocol. The first day you can only use rather the PRP if you're using the platelet-rich plasma, the Lift glycerin water that also comes with the device. That's what I use also to glide the hand piece or the needles over the skin. And also I give you a product called Rescue that comes from SkinPen that you are going to use on day 2 through day 5. And we also have another product called Vampire Face Cream that you can use post-procedure as well, but you would start on day 2. Obviously, you're not going to have any sun. You wouldn't want to get sweaty. I wouldn't go to the gym for a few days because you have open channels to the dermis. We don't want to put germs there. So you want to take those types of things into consideration. I wouldn't go swimming. I wouldn't get in a hot tub. I would be pretty simple and gentle with your skin post-procedure. Thanks guys for tuning in. That's coming to a close with our Q&As for the SkinPen. If you have any other questions that we did not answer, please comment below. Don't forget to like and subscribe. We want to get more of these videos out to you guys. Thanks so much.